Hello! If you've got high blood pressure, you are at risk of having a stroke. Now, following the tragic passing of one of our best-loved Hollywood actors as a result of a massive stroke, I have received requests from some of you to do a video on strokes. So here we are. I'm going to do a two-part series. In this first part, you are going to learn about 7 signs you are having a stroke. That's what's coming up next. You stay tuned. I'll see you in a sec.
Now, for today's 2020 idea to better health, please welcome on stage Dr. Joe.
Hello, welcome back. I'm Dr. Joe of thedrjoe.com. If you are new to this channel, can I extend a warm welcome to you? This is your home of 2020 ideas to better health. So if you haven't subscribed yet, please do subscribe. Now, in this video, I'm going to give you an overview of strokes. I'm going to give you the background cause of strokes, and I'm also going to tell you, more importantly, about 7 signs you are having a stroke, because it's very important you recognize these signs. So let's dive into the presentation now, shall we?
Yes, in this short presentation, you're going to arm yourself with the essential knowledge that you can use to protect yourself, especially once you are able to recognize the signs of a stroke. So, who is usually affected? Well, it tends to happen more in senior citizens. Strokes are more common in senior citizens, but don't be fooled, because strokes can actually happen in younger people, as happened to a young Hollywood actor a couple of weeks ago. In fact, 35% of strokes actually happen in the age group 40 to 69. So something to bear at the back of your mind as far as strokes are concerned. It's not necessarily a problem of old age only. So what's the background cause of a stroke? Well, it has to do with oxygen deprivation to the part of the brain that is being supplied by that vessel. If the vessel is occluded in any way, then there is oxygen deprivation, because your brain cells actually need oxygen for them to perform their function effectively. The consequence of that is any function that is performed by that affected area of the brain will either cease or it will diminish as a result of the oxygen deprivation. So things like speech, vision, muscle movements, as well as memory may be affected. So how many types of strokes are there? Well, there are 3 types. The first one is ischemic stroke. The vast majority of strokes are actually caused by ischemia, and this usually results from occlusion of the blood vessel by a blood clot, and then that means the oxygen supply is cut off completely, and this results in what we call ischemic stroke. The second type is hemorrhagic stroke, less common than ischemic stroke. This one is usually the result of the blood vessel wall becoming very weak, and then it becomes so weak such that the vessel wall actually breaks and it pops, and then you have bleeding into that part of the brain. That is called a hemorrhagic stroke. And the third one is what we call transient ischemic attack, or TIA. Another name for it is a mini stroke. This one is usually the result of a temporary blockage of the blood supply to that part of the brain. And for whatever reason, the blood supply is re-established. And once blood supply is re-established, oxygen supply is also re-established as well as a consequence. And as a result, the symptoms are usually short-lasting, which means everything is resolved within a short period of time. And that's why it's called a transient ischemic attack, or TIA. Now, to the most important bit, which is the signs of a stroke actually happening. So, how do you know you are having a stroke? Here are the signs. The first one is weakness of the face. There's usually drooping of one side of the face. The person might not be able to smile. The angle of the mouth may droop, or the eyelids may actually droop as well. So, weakness of the face, any side of the face is one sign that you could be having a stroke. Second sign is severe headache. We describe the headache as a thunderclap headache. What that means is usually the headache is very severe and is of sudden onset. If this happens to you, then of course you have to be aware of the fact that you could be having a stroke. Then you should seek medical attention. Third sign is problems with coordination. Sometimes it's so bad that the person will have balancing issues and they may actually fall. So something to bear at the back of your mind. If you know somebody who just has problems with coordination and falls over, then they may be having a stroke. The fourth one is vision problems. This may affect just one or both eyes, and it could just be blurred vision, but it could also be total blindness, actually, especially if the vessel supplying the eye is affected. The vision will be severely impaired. Next sign is difficulty swallowing. This can be so bad that it could actually result in choking. So if somebody you know is choking for whatever reason, and especially when they have risk factors for a stroke, you should take them to the hospital straight away. The next sign is weakness of the arm. Usually one arm, but it could be both, actually. The usual sign is that the person is not able to lift the arm up. And then, of course, once you have that weakness, that's almost nearly certain that the person may be having a stroke, especially once they have risk factors for a stroke. You should be taking them to hospital straight away, because acting fast is very crucial. Now, the other thing to mention here is that it might not be weakness of the arm only, or the weakness of the arm may not be there, but you could just have numbness. So numbness of the arm could be a sign as well. The seventh sign that you could be having a stroke is speech problems. So the person having a stroke may just have slurred speech, or may not be able to speak at all. So if the person is not able to talk, and this was somebody who was well all along, you have to seriously consider the fact that this individual may be having a stroke. So these are the 7 signs that you could be having a stroke, and like I said, acting fast is very crucial.
So there we are. The most important thing about strokes is actually recognizing the signs early and acting fast. That is the most important thing, and that's the reason I did this video, so that you know the signs and you can act on it straight away. If you recognize any of those signs, just call the emergency number of your country straight away, because that is the best and the safest thing to do. Now, if you want to learn more about strokes, well, I found a book that you're going to really enjoy. It's written in plain English. I'm going to leave the links in the video description, okay? The video description. The links are going to be there. Go get the book. You're going to like it. Because, I'm going to keep this video short, and that book, talks a lot more about strokes than I have in this video. So, go get the book. The links is going to be in the video description. Now, if you got value from this video, please give it a thumbs up as usual. Hit the like button. And now, if you've had a personal brush with stroke, or a family member has had a personal brush with stroke, I want to hear your stories. Please leave your stories in the comment section, please. Anything you want to say about strokes, leave your comments in the comment section as well. Now, if you haven't subscribed yet to this channel, what are you waiting for? Please do subscribe. The subscription button is just right there in the bottom right corner there. Please do subscribe, because this is your home of 2020 ideas of better health, so you should subscribe. I will encourage you to. I think that's about it in this video. Until next time, this is Dr. Joe signing out, but please don't forget to go get the book. This is Dr. Joe signing out.